This is a special update. There's some recent occurrences, and we felt the need to address the community, address the tribal membership. And starting off, I just wanted to reassure everybody, encourage everybody, and that this is no time to let down your guard. That we're still in the middle of this, and with some of the information that's going to be shared, I would recommend that all of us be really mindful for the next couple of days, and as far as our health officials recommend, it's a really crucial time right now with the information that's going to be shared shortly. So with that, I want to pass it along to the information that's going to be presented. Thank you.
Thank you, John. We will go to Danelle Smith, CEO of Winnebago Comprehensive Healthcare System, for an update. Danelle.
Thank you, Emily, and thank you, John. Good afternoon. I'm Danelle Smith, and I'm the CEO of the Winnebago Comprehensive Healthcare System. Thank you for joining us for this special edition of our COVID-19 update. The purpose of today's update is to provide you with up-to-date information regarding the status of COVID-19 in the community. As most of you are probably aware, the Winnebago Public School and the Educare announced this morning that school would not be in session today. Mona Zavante is here with us today, the Winnebago Public Health Administrator, and she'll be providing some more specific information regarding the status of the positive cases in our community and related information. Dan Berenger is also here with us today, and he'll be providing an update from the Winnebago Public School. As I said, we want to make sure that our community has the most up-to-date and accurate information that is available so that you can be well informed. As we come into this fall season and with school starting, we anticipated that we might encounter some challenges. But this is exactly the type of thing that we have been monitoring and preparing for over the course of the last several months. We've had, quite a number of cases. We had a time period where we had no cases and a decrease in the positivity rate for our community. And all of that is due to the positive actions and safety precautions and things that our community and the tribe and all of our organizations put into place. There's a lot about this virus that we don't know, but there is a lot that we have learned over the course of these past few months. And what we do know that our best defense is physical and social distancing, wearing your mask, and sanitizing your hands frequently in any other high-touch places, wherever you might be, whether it be in the workplace or in the home or in the school. So I would like to remind our community to not let your guard down, to continue to take these precautions. COVID-19 is obviously still in our community and in surrounding areas. So we need to continue to be vigilant and continue to take this seriously. There is also a lot of speculation and rumors and things like that in the community. And I would just like to assure people to not panic, but just to know that the best approach that you can take is to protect yourself and protect your family by doing those things that we've been talking about all along. Practice social distancing, wear your mask, and sanitize your hands frequently. With that, I will turn it over to Mona for some more specific updates, and then we'll move to Dan Berenger. Thank you.
Thank you, Danelle. So good afternoon, Winnebago community. As Danelle indicated, we wanted to make sure that we updated the community as soon as we had some answers. I understand with the closing of the schools for the day that might have caused some panic in some of our families and community. And we did struggle with that this morning on how best to respond and handle the information that was being presented and trying to get everything processed. Due to the fact that we were still gathering data this morning, it was deemed necessary to close the public school, which led to Educare's closure as well. But it allowed us to complete our contact tracing of any outstanding positives that we were aware of at that time. This weekend, we did have several exposures stemming from a gathering and just normal visiting outside our household without masks being worn. I know that we're all struggling with trying to find the balance between how to live our lives, but we also know that this is going to happen. We knew with opening the school that we would have days that we would have to pause and do the right thing for our children and close for a day or two to take those precautions that are needed. We knew that opening up and resuming our businesses, that we would also have to pause and figure out the next course of action that made sense. So what do we do right now? We currently know that we have 6 active cases. The case investigations are being conducted. We have 2 additional positive cases as of right now that we will be reporting on later on this evening as we finish our close contact investigations. We are working as fast as we're able to in order to minimize the spread and contain it, but we need all of your help. As we know right now, all of the cases are isolated and not related. When we contact you, I know that you're upset, but we are just trying to keep people safe. You've been identified as a close contact. We're just trying to limit the spread as much as possible. I know people have a lot of emotions that are going on inside of them, but we're all trying to get through this situation as best as we can. Unfortunately, as Danelle described, there's still so much that we don't know about this virus, but we do have tools in front of us, and that is to identify, quarantine and isolate, and then monitor and test as the circumstances warranted. So I just want to do a reminder about what quarantine and isolation mean. If you test positive, you're placed into isolation, and that means you need to stay in your residence. Social distance from the people inside your home, or you can isolate in an alternative location if you desire, and that can be arranged with the assigned PHN. There's also a list of things that you can do, but you are typically released 10 days from the onset of your symptoms, but everyone is different. If you've been identified as a close contact of a positive, you're placed in quarantine for 14 days. And we do this because we don't know who will develop symptoms and who will not. So we watch you for 14 days, and if you develop symptoms, then you're placed into isolation. So some further notable, after looking at some of the other cases, we wanted to let people know, the community know, that typically close contact identifications from 1 positive is typically anywhere from 4 to 25 people. It's a lot of people, but that is what we're doing with our close contact investigation, is identifying them. Currently, we have 18 households that are in quarantine at this moment, but like I said, we're still doing those close contacts on the 2 that we're going to be reporting on today. This number will change. We will be adding this as a reportable to our dashboard so our community knows how many households are in quarantine at any given time. Some program updates. The hotline will continue to function from 8 to 4:30 because it is not an emergency line. It is for information, but we will continue to assess and determine if additional hours are needed. If people are wanting to be tested, we coordinate with the outpatient clinic upstairs to get it scheduled, which is usually during the day. Of course, if you have an emergency situation, the hotline is not your 911. You need to call the police department or the hospital ER to dispatch the ambulance, or go to the nearest ER is your best course of action. We will continue to do testing with the 12 Clans Unity Hospital Monday through Friday. But also remember, if you were exposed, say today, we will not be testing you tomorrow. We ask you to wait for either symptoms or possibly 5 to 7 days after exposure to make sure that the viral load is detectable. And that's why we ask you to wait and don't test immediately. The Public Health Department was scheduled to add additional services and openings next week, but we will be pausing for a week or 2, and we will determine on the best course of action depending on the current situation. Before I close, we know that there will be more people that will be affected by this virus, and we will continue to work together. I know that many of us are worried about our children and our grandchildren, and I hear that and I understand. So I want to reassure the community again that we are working diligently to identify, quarantine or isolate, and then monitor and test as the circumstances warrants, but each case is different. We will get through this and persevere just as all the ones that have come before us have done by supporting one another. We are in this fight together, and only together will we be able to defeat it by taking it one day at a time, continuing to make the decisions that will ultimately help us reduce the numbers. But I need your help because we cannot do this alone. I need you all to continue to wear your masks, social distance where you can, because it's up to each one of us to do our part to continue to protect our loved ones. Thank you.
Thank you, Mona. We will now turn it over to Dan Farringer with Winnebago Public School. Dan?
Good afternoon, Winnebago community. As you know, we're in a situation here that warranted closing school today to give us more time to find more information out to lead us to make decisions for the future. As a district, we are following safety protocol in all aspects. We take the information presented to us and contact the health department and at times law enforcement to help us get through this situation. The information presented today came to us today, made the decision to close school down until more information was given to us. The information we now have received leads us to not have school tomorrow. We do not have school on Fridays at this time, and no activities through Sunday at this time. We will reevaluate and the situation with help from the health department throughout the weekend to see where we're headed for next week. At this time, there will be curbside pickup for lunch tomorrow from 9 until noon. So we are still providing meals for those students and those home students that are virtual. Also, the teachers will be here and they will be teaching virtual classrooms throughout tomorrow and throughout the next week if we do close down again. So we'll continue to work with our students. The staff will be here and they'll follow safety protocols. They'll be in their own classrooms. They are not mingling. They are not intermixing. So we'll be continuing that. We'll be continuing the lunch again, Monday through Thursday. And on Thursday, you'll also be able to pick up a sack of goodies for Friday to help out with that. Again, we rely on everybody working together, from staff to the community, keep following the safety protocols in place as we get through this pandemic. It's new to all of us, so bear with us as we make decisions. There's going to be a lot of messages coming out through the text messaging, through Facebook. We'll keep everybody as updated as we can through this whole process. I appreciate all those who have worked with us to get this going, to make sure we have the communication, and also the staff here, the administration, as they work hard to make sure that the educational component is met as best we can, and that also the custodial staff to ensure that disinfectant continues to happen, and the kitchen staff. So again, I appreciate everyone that help bear with us, and we'll continue to work hard to keep safe, and we'll go from there. But again, thank you, everyone.
Thank you, Dan. As always, you can tune into our Facebook pages, the Winnebago Public Health Department and 12 Clans Unity Hospital, as well as the Winnebago Tribe of Nebraska and the Winnebago Public School Facebook pages for updates. We will be posting an update this evening. And you can also find us online at www.winnebagohealth.com. We will be resuming our live updates next week, next Thursday at 7 p.m. So you can email any questions you have about COVID for our health officials at covid@winnebagotribe.com, and we will answer your questions then. Thank you all. Thank you, Mona, John, Danelle, and Dan for participating in today's emergency COVID update. We will see you guys all next week. Stay safe, everyone.
Thank you.
Thank you.
We're good, Brandon?